Hello, 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 everybody. Welcome once again to your Wednesday night webinar. I am Dr. Patrick McGrath. It is good to have all of you here, and appreciate your patronage, shall we say, of the Wednesday night webinar. Reminder: Wednesday night webinar brought to you by NoCD. NoCD, a downloadable app you can get through Google Play or iOS. So please check us out. We would love to have you on board and see what we could do to help you if you're in need of any teletherapy anywhere in the United Kingdom or in Canada or in Australia or right here in the old US of A where I'm broadcasting from. A little bit of snow out there today in my neck of the woods, and hope that all of you are having a great time with a little bit of winter if you are into it, and if you're not, give it a few months and the sun will be back, at least for those of us who live in the area where it's gray for quite a while. We're going to kick it off here tonight with a little reminder. Tonight's information is informational purposes only, and we're not giving out specific therapy advice here tonight, but things that maybe if you are seeing a therapist, you could kind of talk to them about or utilize and move forward. And maybe we motivate you a little bit to decide to do a little bit of therapy as well too. So let's see what we got. Chloe says, is it abnormal to have one OCD fear for years? I've had the same theme now for almost 3 years. Would therapists begin to look outside of OCD at this point? I know themes are supposed to hop around. Well, they're not supposed to hop around. Sometimes they do, sometimes they don't. You don't have to have that. I treated someone who had the same theme for 70 years. He was the oldest patient that I treated, and he had the exact same theme for 70 years, and it did not hop around at all. So, Chloe, you are 67 years behind him in terms of the length of time that your OCD has stayed on the same thing. OCD does not have to hop around to other things. This sometimes can be a little bit confusing for folks. Like, if it only stays on one thing and it matches something that might be more of a specific phobia, the specific phobia might be the better diagnosis for someone than obsessive compulsive disorder. However, the treatments are going to be very similar with exposure and response prevention therapy that will come through. So just know that is potentially the case. But this person that I treated, there were at least a few other things that also kind of happened here or there along the way, but that one theme never wavered. That theme was there the entire time. So, Chloe, you don't have to have the hopping around whatsoever. It is not at all required. Anthony says, I'm a chronic people pleaser, and it's made me miserable. I can understand that would be very difficult, because what happens if you're in a room and I like speeches being given word for word, written from a piece of paper, and my twin likes speeches to be made up as you go along. If the two of us are judging, you do it my way, I'll give you 100 and he will give you a 0. You do it his way, he'll give you 100 and I'll give you a 0. And if you try to do it both ways, we'll both give you zeros, because we're both very stubborn and we only want it to be done our way. So, Anthony, you are at best going to get a 50%, which is a failing grade in this situation. Have you heard about an OCD people-pleasing link? Any tips on how to stop people-pleasing? Thank you for all of your wonderful help. Well, Anthony, there's definitely a part of OCD, especially kind of in the moral scrupulosity aspect. And if you want some really in-depth information on that, take a look at the International OCD Foundation. My good friend John Hirschfield and I did a 3-part series on moral scrupulosity, where we talk a great deal about how people with moral scrupulosity have a very large fear of offending other people. And what if they were to do or say something that others would find offensive? What if they were to somehow interfere in somebody's day? And what if they were to cause that person to, have a bad mood or be delayed in some way, or somehow like they missed their train because of me or something like that? I once treated someone, I can give you a little hint on this, who started off, and this is very common in OCD, started off every question with, I'm sorry. So she would come up to me and she would say, I'm sorry, I just wanted to ask you a question. Or walking past me, I'm sorry, just how you doing? That kind of thing. And I noticed the I'm sorry being a compulsion. So I said to her, here's the deal. We got to work on this I'm sorry thing because that is a constant compulsion that you are doing. And we're not going to get far on a lot of this OCD stuff if you don't really work on that. So she agreed, right? Because I don't do ERP on people without their agreement. So she agreed. And I said, tomorrow, if you say I'm sorry, I am not going to accept your apology, just so you know. She said, okay, I hear you. I'm okay with that. That's what we're going to do. So toward the end of the day, she knocked on my office door and said, sorry, I just had to ask you a question. And before she even asked the question, I said, I don't accept your apology. And then she said, but I'm probably bugging you right now. So I am sorry. I said, that's, you know, you can be sorry, whatever. I don't accept it. And she stayed at the door for an hour and a half, sometimes just staring at me, hoping that I would say, okay, I accept your apology. Now and then asking me if it was going to happen, would I accept her apology? Sometimes a little tearful that I wasn't accepting her apology. And after an hour and a half, she said, okay, I'm going to go home now. I said, all right, I'll see you tomorrow. And she came back the next day and she came up to me and she said, thank you. Thank you for not accepting that apology because I had to go home last night and feel horrible. And I did feel horrible for a couple of hours. But I learned that I could handle it. I figured if someone didn't accept an apology that I gave to them, that it would destroy me. It would ruin me. There would be no way at all that I could overcome that. And I didn't die, and nothing horrible or awful happened. And I learned how to handle it. So thank you. I said, all right, well, I am very happy to have helped you with that and know that we're going to continue that. I will still not be accepting any apologies that you give. She said, I agree. That's what we have to do. It's got to happen. And I'm also going to start to tell my family members and my friends and my coworkers eventually, not yet, that will be the hardest one, but I'm going to get there, that they have to stop saying it's okay whenever I say I'm sorry. So, Anthony, people pleasing can be a big part of obsessive compulsive disorder from that moral scrupulosity aspect where people are very, very afraid that they might do or say something that could come off as offensive to others. And they'll do everything that they possibly can to make sure that it doesn't happen. So, Anthony, I'm going to give you some exercises to consider if you're working with a therapist, right? And these are be the types of things that I would start people off who have this fear of people pleasing. The first one might be if someone says hello to you, do not say hello back. Another one would be if you're at a store and you don't know where something is, you go up to someone and you ask them where it's located. And after they give you the answer, walk away. Do not say thank you. Right. And another one would be if you're the kind of person who would always let someone else go through a door first, I want you to go through the door first instead of letting everyone else go through the door first. Those would be, potentially some of the exercises that you can practice to sit with your discomfort, right? So work those out with your therapist if they think that those might be things that would be appropriate. But those are typically the types of exercises that I start people on with small, low-level types of things and work your way up. Now, Anthony, I can't guarantee that somebody won't be mad at you, right? Because you didn't say thank you or hello, or you cut them off and walk through a door before them. I don't know how everybody's going to act. What I do know is that your OCD is not going to like it and it's going to try to punish you. And your job, Anthony, is to say to your OCD, I hear you, but I don't have to listen. I don't have to pay attention, and I don't have to do what you want me to do. So I'm going to be moving on. Thank you, OCD. But you are kind of like fish and in-laws. You've gone bad. It's been more than 3 days. I don't need you living in this brain anymore. It's time for you to go. It's time for you to go. Dem says, how do you stop ruminating about ruminating? I have different subtypes of OCD that all came postpartum. And it's like I keep checking if I have thoughts, mostly harm and pedophilic related thoughts. Well, as long as you keep checking to see if you have thoughts, you are going to keep having thoughts. There's that, of course. I mean, there's no way to not have thoughts if you keep checking to see if you have thoughts. It'd be like, there's no way to not think of our friend the pink elephant if I tell you don't think of the pink elephant, right? You must think of the pink. It's just the way that our brains are functioning. The vast majority of you watching this right now, once I said don't think of a pink elephant, thought of a pink elephant. So Dem, I'm going to suggest what I would do if you were my patient. I would have you wake up, Dem, and say, I sure hope that I have all those thoughts today. I sure hope I think about harming people and pedophilic things. I'm very, very hopeful those things are all going to pop in my head. And then that's going to really confuse your OCD if you do something like that, because your OCD is like, wait, no, no, hold on, whoa, whoo. I told you not to think of those things. Right. I get that. But see, OCD, here's the deal. Your little game, OCD, is this. You tell me not to think of something, and then by the pink elephant nature, I think of it, and then you get to punish me for thinking it because you told me not to think it. And then the punishment means that I have to do compulsions and I have to feed you. And you seem to only get bigger and stronger and fatter when I give you compulsions. And I've decided that I'm going to starve you out. And the way that I'm going to do that is not give you compulsions. In fact, I'm going to go do all of the very things that you don't want me to do. I'm going to purposely think of all of these things and have them in my head throughout the day to the point that you realize you can't intimidate me with these things anymore because these things no longer bother me anymore. Right? Now, Dem, just beware of the back end spike. Someone will probably ask about the back end spike at some point tonight. It seems that the last 4 weeks we've had that question come up sometime, so I wouldn't be surprised. So if you did ask that question somewhere tonight, listen up, because here it is. Your OCD is going to do one last attempt at the end to go, oh, wait a minute. Now you're purposely thinking these things? Oh, my, that must mean that you're not bothered by them and that you actually enjoy them. And what a sicko you are for actually enjoying these things and thinking these thoughts are okay. That's another OCD trick. So just be ready for that one. And when it happens, go, wait a minute, that wise sage, Dr. McGrath, told me that this was going to happen, that this is exactly what you were going to do. Now, why do I know that this is going to happen? And I've said it before, and I will say it again here. One thing all of you need to know, and to me, why OCD is not actually scary, is for this very reason. So everyone, pay attention here for a moment. This is why OCD is not actually frightening. And here it is. Because it's predictable. We know exactly what OCD is going to do and how it is going to do it. And if we know that, and we really approach it from that angle, how frightening can it actually be if it's 100% totally predictable? Right? I mean, imagine seeing a horror film for the 50th time. Are you as scared the first time somebody pops out from behind the weeds and with a knife and stabs someone? No. You're sitting there going, all right, here it comes, here it comes, here it comes. Oh, what a stab. Good one. Yeah. It's predictable. So then you might say, yeah, but okay, I get that it's predictable. Why am I still afraid of it, though? Because it's predictable with a lie. And the lie that it's predictable with is but what if next time is the time? And that's the hook right there. That's what catches you. And you're like, oh, crap. I didn't think about that. Next time might actually be the time, right? And boy, what if it is? Wouldn't that be horrible if next time was actually the time? So maybe it is best if I just do exactly what OCD wants me to do, because it has made me a promise. And the promise is, if I do a compulsion, something bad won't happen. And geez, what have I learned so far when I listen to what OCD tells me to do? It seems that bad things don't actually occur. So, maybe this here OCD thing is actually true and real and right and good, and maybe I should just listen to it some more. Or OCD's an opportunistic jerk and uses a great deal of trickery, right? And it snags you back. Okay. Lisa says, "Good evening, Dr. McGrath. I currently have a friend." Friend, right? No, never. I currently have a friend that is trying to encourage you to get help for your OCD, but right now I'm just reluctant and not at the point of being really active, ready to actively get help. What should I tell him next time I talk to him? Thanks. Well, Lisa, good for you. Let me say this: there's probably very little reason to go do treatment if you're just going to fight doing treatment, right? I think what you can say to your friend is, listen, I appreciate the fact that you recognize that there's something going on. And I appreciate that you've done research to know that there is something available for me. And I'm going to take that information. And when I'm ready to go get the help that I need, I'm I'm going to use it. And believe me, you'll be the first one to know. But at this point, I'm not quite there yet. And I think that you could just continue to say that. Now, my hope for you, of course, Lisa, is that you will get there soon, right? And I hope that you will go for that treatment because it could be very potentially helpful for you. Right? But Lisa, that has to be on you. I can't make anybody do anything. I don't force ERP on people, right? And when you're ready, Lisa, we'll be there. Right? We'll be there to try to help. Snaky or snacky, hard to say, but I'll go with snaky. Hi, Dr. McGrath. How do I reconcile contamination OCD with being immunocompromised and being careful not to get sick? I'm not sure if I'll ever be able to ditch the mask. Well, I'm not saying that you have to ditch the mask, right? If you are immunocompromised and the mask seems to be what keeps you healthy, then I'm not going to tell you not to wear the mask, right? Now, there may be a degree. Like, if you're alone inside your home and you're wearing a mask, that might be overkill. And maybe you've decided, well, I have to wear the mask for the first 3 hours I'm at home because what if I've carried germs in and then they leave my clothes and they start floating in the air and everything? So it would be good just to keep that mask on for a few more hours just to make sure the floaters don't get inside of me or something like that. Those types of things I might challenge with you, but you know, for people who are immunocompromised, it might be very wise for them to wear a mask. When my wife was really sick, when the cancer got worse, and if we would travel, she would wear a mask, um, and it was just it seemed like the good thing to do. She was on a lot of drugs that had suppressed her immune system and it caused some potential issues. So we both wore masks at the time. I did it to also help protect her as well too. And I had no qualms about it whatsoever. So, I mean, you could have snapped my picture and put it on the National Enquirer, said, famed OCD doctor wearing a mask outside. And I would have said, yeah, I'm totally wearing a mask because I happen to be married to someone who's severely immunocompromised and has a fatal disease and is not going to make it. But if wearing the mask lets her live a little bit longer without getting some other things, then that's what I'm going to do, right? And that's what she did too. So um, here's where I always draw the line. If you've been given things from your doctors and they've told you what to do and you do them, that's fine. But when you start stepping over that line, that's where OCD tries to take over. So that's all that I want you to really pay attention to is if you're going over the line of the recommendations that the doctors have made for you, know that you're then potentially dabbling into the OCD things. Okay. All right. Bradley says you did something years ago well you were not proud of when you were 16. You went to visit someone who might have been younger, and nothing happened. Okay. You didn't talk on the phone with her the day after. You can't remember what you talked about, but you feel guilty about it, even though nothing happened after. And you can't remember if maybe there would have been some dirty talk or something like that. All right. So, Bradley, a kind of a classic example here of false memory OCD, where we wonder about something that might have happened in the past, and without a absolute 100% clear recollection of something, OCD loves to jump into the worst case scenario and say, well, maybe it did this, right? And maybe that would have happened. And boy, it'll want to run through all sorts of different types of things for you to do. Maybe you should find where this person is and reach out to her and ask her if you did any of these things. And if you did, apologize to her. And how do you make amends for something like that? And maybe you should take yourself to the DA and say, when I was 16, I did this, but I don't know that I did anything. And I don't think that I did. And I don't remember doing anything. But what if I did? And I deleted the account, but I don't know what it is. Can you get the FBI to go back and trace my phone on the dates and see if maybe they could find the person? All of these things that the OCD brain will try to run through to see if there's some way to get the 100% guarantee that you didn't do anything that would have been inappropriate whatsoever. But of course, the problem is that even if you found her and even if she said nothing happened, your OCD would go, yeah, but maybe she's just saying that. And maybe she actually is preparing a lawsuit, and maybe one day they'll show up at my door and arrest me or something like that. We can't really know for sure. So then you'll want to check with her over and over and over again. And I've seen people who have done this who then have actually gotten in trouble because they keep checking in with people, and finally, they're accused of harassing people because they keep asking these types of questions over and over to get reassurance. One person I know who moved into a new neighborhood very quickly alienated all of the other families in the neighborhood because there was a party that they had at their house, and they had a couple of drinks and got worried that maybe they might have said inappropriate things to some of the neighbors and started calling the neighbors, then going to their homes and asking them and everything. And pretty soon, none of the neighbors wanted any interaction with this family whatsoever because this person couldn't stop seeking the reassurance about it. So, Bradley, there's just no way to know with 100% certainty what it is that you want to know. And of course, in OCD treatment, we aren't attempting to get to 100% certainty about anything. What are we attempting to do? We're attempting to learn to live with doubt and uncertainty. Now, Bradley, recognize this. You already live with doubt and uncertainty about pretty much everything else in your entire life. I mean, I have no guaranteed certainty that this webinar will continue all the way through 8 o'clock Central, right? I could lose power. The camera can go out. Internet can go down. There's all sorts of possibilities that could happen, right? So I have absolutely no guarantee that all of this is going to work out for me, right? And if anybody would attempt to try to convince me that there is a absolute guarantee on this going all the way through, I would say, I really appreciate you saying that, but just because you say it doesn't make it true, it doesn't make it real. So if I can't even guarantee that this webinar is going to make it for the next 20 or 34 minutes, no one's going to guarantee you about a memory of something that happened potentially decades ago, right? So your goal, Bradley, is to live with that uncertainty and learn that you can handle that. You don't have to like it. It doesn't have to be comfortable, right? But you can absolutely live with it. Let's see. Joe had a very similar question. So I'm thinking, Joe, the answer that I just gave to Bradley applies directly to you as well, too. Interesting that both of you had almost identical questions. Darla says, thank you for asking those questions. You feel based. Saying that to Sarah up earlier. Okay. Jaded says, sometimes I get very noticeable groinal responses when looking at myself flexing in the mirror and wearing tight clothes. Not a fan of that feeling. Okay. Well, then I would, if you were working with me, I would have you purposely do that and learn that you can handle those kinds of feelings, and that that's nothing that you have to be worried about or ashamed of or disgusted by in any way whatsoever, right? And I'd have you probably do it so very much that it would just get boring and you wouldn't have that feeling anymore. But I'm going to bet right now, again, the pink elephant experience here, when you do that in the mirror, you're hoping you're not going to feel it and you're doing all that you can to try to make it go away. But OCD is going to start checking for things. And if OCD is checking, it's going to find something. And you're going to be like, wait a minute, was that a tingle? Was that a grunt? Maybe it was. Oh crap! Why did I? It probably was. And yeah, OCD is always going to find the thing that you don't want it to find, right? So do the opposite. Prescribe the problem. Stare in that mirror in tight clothes, flexing until you just are bored with yourself. And then once that happens, I don't think you're going to have that groinal experience anymore. Potara says, I currently am undergoing with sexual orientation OCD. And how long does this take to recover? I know everyone is different. Well, you're right. Everyone is different. So it's hard to say, but I will tell you this. Doing your ERP and doing it consistently will be the thing that helps you get through it the most. So please do that. Jalissa says, quick question. What do you do when you're dealing with pedophilic OCD and one of your exposures isn't something you value? For example, my therapist wants me to do a script imaginal one eventually, and you just don't value that. Well, if it's about something that doesn't really bother you, I don't know that you need to do a script about something. So it's hard to say when you say the words value here, what you mean by value. Do you not value what the therapy is trying to do, or do you not value the subject of the script that's going on? So I would need a little bit more information on that, if at all possible. Okay. Let's see. Codfeds, doctor, could you explain compulsions that lead towards the obsessions? For example, my compulsions keep leading me towards my obsessions, and got to the very end where I mentally decided I will do, and then you're down here a little bit more, the obsession, but at the same time, I won't, due to the luck I left the scene, would I have carried it out? Little jumbled there, but let me see if I can kind of figure out exactly what you're trying to say there. You might have done the obsession so many times now that the compulsion just kind of feels automatic, right? It is a possibility that you're at that point where it just feels like it's totally automatic at this point in time. Now, this can happen, right? And to the point that people don't even feel like feeling really like, how do I want to say this? They don't even have an obsession anymore, right? That it's just not there. So then it can feel like you do the compulsion and then the obsession follows. But I think what's probably happening, and again, this is talking out here, not knowing you at all, but I have a feeling what is probably happening is this. You're triggered. You've been triggered so many times that it's just automatic to go right to the compulsion. You do the compulsion, you feel good, and then but what if it happens again comes, and then it feels like the compulsion is probably triggering the obsession. But I think that it's kind of like obsession understood, compulsion, relief momentarily, right? And then have to do experience the obsession and do the compulsion again, and that's the wheel that you're on. So I'm going to bet that's probably the way that it's going. Hard to say for sure, but I would bet that that's probably what's happening. Jalissa asked, should I do the script anyway or voice your concern? Jalissa, it never hurts to voice your concern in therapy, right? If there's something that you're not agreeing with in therapy, please bring it up with your therapist always, right? I tell my patients the same thing. If there's something that we're working on that they just don't feel like is going to get them to where they need, let me know, right? I may miss something. I may try something that doesn't work. That still happens. It's okay. Yeah, I've been doing this for a long time, but I'm not perfect at it, right? There's still things that I learn about OCD and treatment all the time. So absolutely, talk to your therapist, please. Troy says, how do I love and accept myself with OCD? I keep thinking loving myself is a compulsion when I feel insecure. Well, interesting question. And I'm going to put this out to the 117 people that are watching this right now to type some comments in. What is it like to like yourself? Is that difficult? Is it hard to accept yourself? And here's the second part of it, because I'm going to bet many of you are probably going to say yes to that. But here's the part that I think is the most important piece. If you were sitting across from Troy right now, and Troy said to you, I cannot accept myself with OCD, would you say to Troy, that is a great idea? Or would you challenge Troy on working to accept himself? And if you would you be willing to challenge yourself to accept yourself with OCD if your initial thought was, it is also very difficult to accept myself with OCD? It's unfortunate, right? How OCD leads people to feel so bad about themselves. It's unfortunate that OCD doesn't care about anybody but OCD. OCD doesn't care if you're successful at school or at work or with your friends or with your family. OCD wants one thing, and that is all the attention in the world. OCD wants all of the compulsions. OCD wants all of the food. So if OCD was really out there to be helpful and OCD really cared, I'd be the first person to try to give OCD to everybody in the world. I would make it my mission to assure that everybody had OCD. If it was truly a helpful thing and it was absolutely out there to assure that everybody in the world had a great experience, I'd be all over making sure that everybody had every opportunity to develop obsessive compulsive disorder. I do the opposite. I spend my life trying to help people get rid of OCD because it isn't something that makes their lives better. It isn't something that helps them to improve their performance. Despite whatever articles you might read in some ridiculous pop psychology kinds of areas, OCD just doesn't make life better. Okay. So one of the things, Troy, that OCD may try to do, and I'm going to spend a little time on this one, everyone. So put your seatbelts on. One of the things that OCD might try to do is, Troy, you're pretty worthless. And I, Troy, have the answer. Troy, I can redeem you. I can make your life meaningful. I can give you purpose, Troy. And I'm going to do that by guaranteeing outcomes for you that will shine like the brightest star in the sky. Troy, all you got to do is submit to me. Troy, I'm going to throw out a bunch of stuff at you. And you, Troy, are just going to agree wholeheartedly that you're going to go along with anything that I say. Okay. So, Troy, if I tell you that whatever thought or image or urge you had is bad or awful or horrible or shameful or disgusting or guilt-ridden, you're going to listen to me. And then, Troy, you're going to do whatever mental or behavioral act that I deem appropriate. And upon the completion of that to my satisfaction, I, Troy, will allow you to feel okay for a little while. Might be a millisecond, might be a few minutes. Never know. We'll see. And then, Troy, I'm going to remind you that if you want to stay feeling that way, be sure not to go down that path of what you were thinking that led you to have to do that compulsion again. Now, big parentheses, everyone. And here's the big parentheses. By me telling you not to do that, you're going to go down that path again. Then you're going to do the compulsion, which I love. And then I'll grant you a little bit more feeling okay, close parentheses. If you want to stay on the hamster wheel of hell, do what OCD wants you to do. If you want to get off the hamster wheel of hell, you do the opposite. All while dealing with the biggest fear that OCD is going to throw you if you start to do the opposite, which is, yeah, but what if, blah, 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 blah. Because that's what OCD will always use to hook you back. And this is where you make the decision to be brave. Yes, OCD, I hear you say that, but I don't believe you when you say that. So I'm going to move on from what you want me to do, and I'm going to do the opposite. Because it turns out the people who don't do what you want them to do are the people who are doing much better than I am. And therefore, that's the route I'm going to take. You see how it goes? I hope all of you with OCD will spend some time thinking about this and about the fact that maybe one of the reasons you don't want to accept yourself is because OCD doesn't want you to accept yourself, because OCD is using that as one of the ploys it has to control you. It's a little Stockholm syndrome, gaslighting, whatever you want to call it, that OCD does to get you to believe that you are worthless and you're only okay with OCD and you're nothing without it. Now, you don't have to fall for that. You don't have to believe it to be true. And there's help available if you're looking for it. In fact, you can get that help through an OCD. An OCD, a downloadable app you can get through Google Play or iOS. Check us out. And we're available in the United Kingdom or Canada or the United States or Australia. And we've got therapists waiting to meet with you. And we also do other things like work on hoarding and trichotillomania and excoriation disorder and tics as well, too. And if you might know someone in your life who's not quite ready for primetime therapy, well, we've got these NoCD 411 education sessions that we also do for people as well. So we hope that you will check us out at nocd.com or download the NoCD app. Piper says, my partner is currently in the hospital and I struggle with sexual orientation, OCD, and COCD. Sorry, I don't know. There's so many new things come out all the time that I'm not sure what COCD is. So you keep telling yourself that you're going to get sick or you've done something to her to make her this sick. You don't remember. Oh, contamination is probably what it is. Okay. OCD. So you keep telling yourself that you're going to get sick or you've done something to her to make her this sick, but don't remember. Well, Piper, you may tell yourself that, right? But must you believe it? Okay. Piper, I'm telling myself that prior to this webinar, everyone who's watched these webinars knows what's coming here. Piper, prior to this webinar, I'm telling myself that I ran across the street with a Molotov cocktail and threw it at my neighbor David's house, setting it on fire. Then I ran into the middle of the street, took a poop in a bag, and then set it on fire, put it in front of my neighbor Josh's house, did ding dong ditch with the poopy bag, and it was on fire. And he came out and saw the fire and he stomped on it, and then he got poop on his shoe. And I laughed at him for it. And then I shot 3 geese that were flying over my house. And then I came and did the webinar. Now, Piper, it is possible that I did that. All of those things are possible. I'm going to go with the probability of being amazingly low at that. And I'm going to accept the fact that possibility and probability do not equal each other. And therefore, I'll be okay with the thought that I might have done it, and just kind of leaving it there without having to do this. Hey, everyone, I'll be right back. I just have to make sure that my neighbor Dave's house is not on fire, and that my neighbor Josh doesn't have a poopy shoe right now. Just give me a moment and I'll be right back. No, I'm not going to go do that. In fact, I'm not even going outside. Well, no, I do have to go outside because I have to put my garbage out. It's garbage night. So, but I will not go look for 3 dead geese somewhere or something like that to see if I actually might have shot some geese. I'm just not going to give in to what something in my head tells me might have happened, right? And that, Piper, is where we want to go with you as well too. We want you to be able to recognize that just because something is there in your head does not mean that you have to give it the time of day or pay much attention to it whatsoever. Okay, that's your goal, Piper. I hope that helps. Abba says ways to manage OCD, changing things rapidly. Well, I would still pick one and continue to do ERP to it, because that might be a distraction. You start to work on something and then OCD says, that one doesn't bother you anymore. Now this one. And then you try that and now that one. And it's always kind of moving things around so that you can never truly get an ERP experience. So pick one thing, continue to do the ERP for it, really get the skill down so that no matter what, then after you practice the skill, no matter what happens to pop into your head, you're going to be able to apply that skill to it and see where it goes. Dreamland says, do you have a TikTok where you go live more often? I'm thinking you're meaning TikTok there. I do not have a TikTok where I go live more often, but I don't know. Maybe I should. I'll have to look into this TikTok thing that you speak of, or TikTok, or I think it's TikTok. I never used it, so we'll see. Meg says, I struggle with false memories of things that never bothered me before. I always seems that in my past I had bad intentions regarding things that happened. Any advice on how to believe in myself and believe that my intentions were not bad? Well, Meg, I'm not going to go down the road if your intentions were good or bad. I don't know what that really means personally, and I never judge thoughts or anything to be good or bad in any way, right? Just because you have an intention that you think was bad, someone else might have enjoyed that intention and thought that it was awesome. So intentions are subject to perception or interpretation in these types of situations, and therefore I don't know that we need to spend time trying to judge them as good or bad. Now, taking a look at things that have happened in the past and being bothered by them, we did talk a little bit about false memories already today at the beginning of this, with that notion that OCD wants a 100% guarantee that if you did something, you did it in a certain way with the correct intention, because if you didn't, then you could be the one that's responsible for something happening or going bad or wrong or something like that. And so, Meg, I just want you to recognize that if I pick up this stapler right now with a really bad intention, right, it doesn't make me staple my eye shut. I can even kind of do this right here. It doesn't force me to really dig my face in there and staple it shut, right? Or I could pick it up with a good intention and knock myself in the head with it, right? So here I've had a bad intention and didn't do anything, quote unquote bad intention. Then I had a good intention and I actually did something. So do intentions actually force things to occur, or is it just something that OCD likes to pick on and say, oh, well, not only is there an action, there's an intention too. Ding, 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 ding. We have found something else to infuse OCD with. Now it's not just what people do, it is the intentionality behind all of the things that they do as well too. Oh, this is the greatest day ever, says OCD. I have just found something else to be OCD about. Woohoo, party. Yes, here we go. And that's what OCD is going to do, right? It's going to try to just latch on to all these other things that for the vast majority of people, most people don't care about, right? But OCD cares about all of the things, especially the things that most people don't care about whatsoever. OCD loves those things. OCD lives in those little shadows all the time for people as well. Joe says, is it possible harm OCD can be trauma induced? For example, I became afraid of inadvertently hurting people after getting intrusive homicidal thoughts on an ADHD drug. So is it OCD or learned? Well, yeah, it can actually be induced by certain things. We know that this can happen this way, even though the DSM often uses a rule out in it saying that something was induced by a drug or something like that. But I think that they're just meaning that more in the short term piece. But if it's something that's been around for quite a while, as it sounds like maybe it has been for you, then and you're doing all sorts of compulsions and rituals and things along this, and you have these intrusive thoughts around hurting people, it sounds like OCD to me. So at this point, I'm less concerned about where I think you're going is like, why did it happen and what do we call it and everything. We know that we've got a darn good treatment for it. So let's do that, right? Let's use that good therapy, Joe, and see where it goes. Dreamland says, you need therapy, but it's expensive. Well, try an OCD because we do take insurance. See how it goes. Kay says, good to see you again. Well, good to see you too, Kay. Welcome back. Nerva says, somatic OCD, health anxiety. How do we recognize the line between pushing a doctor for more tests due to our OCD lying versus us advocating for our health? Well, boy, what a good question. I had a lot of discussion on this earlier today in some case consultation groups we were doing, actually. And I would say this, if you've gone and you're not satisfied with an answer that you've gotten from a doctor and you're still having symptoms and things are happening, and other people can witness those symptoms for the most part. Doesn't have to be everybody, right? So don't just read it into that. I'm just saying. And you decide that you want to get another opinion. I don't have issues with people getting other opinions personally. I really don't. If I'm not going to have an issue with you getting another opinion from another therapist, do you want to compare the kind of therapy that I do maybe with the type of therapy somebody else does? That's great. That's fine. Go right ahead. That doesn't bother me whatsoever. In the same kind of way, if you're not satisfied with an answer that a doctor gave you, and you want to see maybe a specialist in that situation, and it turns out they also say they don't see a problem with this, then I think, well, all right, maybe there's something going on there in my head about this versus what anybody else is doing. Now, the problem, of course, is you're always going to see studies about, oh, this person was denied tests 17 times and they all came back. And then finally one doctor, sure. Okay. I can't give you a 100% answer here. Right. So I just really want to state that claim that I cannot give you a 100% guarantee that the second doctor or specialist that you see is going to be right on something. Probably the vast majority of time they are, but this is where then it comes down to, if you're repeating things that you've done already, I think that's where OCD loves to go, right? But if there's something new potentially that's out there, that might be less OCD. Might still be some OCD, right? I'm not going to say that it's not any OCD, but there might be a little bit less influence on OCD there. Now, this could also go to research as well, too. If your entire time is spent researching, trying to find something else, well, that could also be some OCD going on as well, too. So there's always a matter of degree, and there's no great answer for this question. I wish that there was, right? I wish that there was. So tests, yes, they give us pretty good indications of things. They are not guarantees for most things, right? I understand that. But at the same point, a plethora of tests all pointing in the same direction most likely is going to mean whatever that means, right? Not saying it's perfect, but most likely is going to mean what it means. And this is where you have to kind of decide, All right. What if I really give in to ERP for a while, right? And I see how I feel after doing ERP. And after a good round of ERP, or even some anti-anxiety kinds of medications, the antidepressants, the SNRIs, the SSRIs, or something like that, or even going into a tricyclic if that's helpful as well too, and kind of going down that road. If those don't offer extra relief beyond what you've already done from the medical world, then maybe you've been able to more rule out that there's a psychological component to it and might require some other things that are going on as well too. But don't just rely on the medical piece to be the only thing to help you here. Very often what you feel physically can be amazingly influenced psychologically. Okay, so don't rule that out as being a possibility. Alyssa says, new to figuring out what I've been struggling with is OCD, but because it's personally manifesting through distressing thoughts, how can I assure myself it's really OCD and I'm not a terrible person? Well, there is no 100% way to do that, Alyssa, and that's part of the rub of the disorder, is that your OCD is going to tell you you need the 100% guarantee that you're not a bad person, or else you're a bad person. But OCD, being the doubting disorder, will doubt every answer that it's ever given. So everyone in the world can come up to you, Alyssa, and say, Alyssa, you're not a bad person. I promise you're not a bad person. You're really not a bad person. And you could say, well, thank you. I really appreciate that. But what if I am? So I'll need another person to promise me that I'm not a bad person. Well, no amount of reassurance in the world, Alyssa, is going to guarantee to you that you are not a bad person. So then therapy has to really focus on the distress that you feel about not having the guarantee that you aren't a bad person. And that's where you would really work with a therapist on, not in getting the answer that you're not a bad person, but on being comfortable with the fact that you'll never have the answer that you're guaranteed to be a good person. Hope that helps. Jess says, in your journey with OCD, you've discovered OCD is more fearing the feeling than the thought. It's easier to believe thoughts are just thoughts than to believe I don't have to do anything with the feeling. Thanks, Jess. Thanks for offering that. Appreciate that. Emily says, do really intensive, vivid dreams of compulsions mean anything? Not that I'm sure of, but, it could just mean how entangled your OCD is into your life that you're even having those happen in your dreams as well, too. Let's see. Someone's asking just about some NoCD therapy. You can reach out to care@nocd.com if you have any kind of specific therapy questions about cost or things there. Care@nocd.com can help you with that. Smiley asked about ruminating. We've talked a little bit about that already. Mary asked, what exactly is exposure and response prevention therapy, please? Mary, it's two parts. It's purposely exposing you to things that are uncomfortable and having you stay in that experience without doing some kind of safety behavior or compulsion to neutralize it. That's the response prevention piece. Why would we do that? Because I get that it sounds a little rough as I describe it that way, but it's purposely rough, right? So Mary, if doing compulsions helped people, we would tell people to keep doing compulsions. But what do we see when people do compulsions? Their OCD gets worse instead of better. So if doing compulsions makes OCD worse, what if not doing compulsions made OCD get better for a lot of people? Turns out it does. So that's why, Mary, we do exposure and response prevention. We purposely expose you to the themes of your obsessions, and we have you not to do the compulsions that you typically do to learn that you can handle that without having to do a compulsion. Lots of interacting tonight. I like to see all of you supporting each other there. G says, I feel like sometimes I have a good OCD day, but I find myself wondering if I'm manic or something because I'm in a good mood. Yeah, OCD will do that. Never look a gift horse in the mouth, says OCD. So if anything good is going on, OCD is going to be like, wait a minute, it shouldn't be happening. We shouldn't be having anything good happen. There must be something really wrong with me for the fact that something good happened. Maybe I'm manic, and maybe I'm overly happy, and maybe I've ingested a drug that makes me happy or something like that. This can't be. How is it possible? And OCD won't let anything go, right? It's going to grab onto any and all things that it possibly can. So just kind of keep that in mind, G, that that's exactly what it's going to do. And OCD doesn't want you to feel good without OCD, because then that means you're starting to learn that you don't need OCD to run your life for everything to be okay. Because that's what OCD wants you to believe. OCD wants you to believe the only reason why your life would ever be okay is because you have OCD. And what we want you to recognize is that is just crap. That is not the case at all. Because again, if OCD made lives better, well, we'd be telling people to develop OCD, and we'd be teaching people to develop obsessive compulsive disorder as well too. I like people. I just scrolled down to the end here. Don't do TikTok. Okay, that's kind of funny. Jimmy says OCD sucks. I'll go with that. Yeah, and yeah, this is great. I love to see everybody tonight telling stories and supporting each other. And Alexis says, just a comment, but Dr. McGrath, you've helped me so much when I was feeling so distressed in the NoCD app. Thank you for being such a positive light. Well, thanks, Alexis. I appreciate that. Really do. It means a lot. So, everyone, we're getting toward the end of our time here. I want you to, again, remember what we've talked about. Acceptance of yourself is difficult, right? It can be very, very hard to do, especially when you have OCD that says, you are a horrible person. You suck. But I am the cure. Let's not listen to OCD's lies about the ways to be better, the ways to feel good about yourself, because I still haven't met someone that that said to me, pretty darn thankful for having this OCD, because it's really made my life a lot better. I'll leave you with that tonight. Remember, everyone, check us out at nocd.com or download the NoCD app. We're there for if there's anything that you need, and we would love to be able to assist you with any kind of therapy that you might need for the obsessive compulsive disorder that is going on in your life. Thanks once again to Paul Melia, our awesome theme song writer. We appreciate you, Paul, very much. Make it a great one, everybody. See you next week.